I think on the government part, I'm not being supportive. We've been trying to ensure that we develop all the necessary protocols to ensure that people comply. As well, government has tried to balance the response with the current economic challenge. But unfortunately, we are not being helped out by the behavior of the citizens, we in the community. I happened to be in a mechanic workshop yesterday. I remember we have over 50 people there. I was the only one wearing masks. Even when I tried to interview some of them, why are they not wearing masks? A lot of them were, there were a lot of misconceptions. Some were even saying government has labeled malaria as COVID-19 and so on. So it's really challenging. And I think that if the cases continue to rise, there will not be any option that the government to a kind of ensure there is a lockdown. But my only advice is that we shouldn't, well, we should learn from the first, learn lessons from the first wave, whereby it was a kind of a kind of top bottom approach. I think before thinking of any lockdown, the government needs to engage all the major stakeholders, the road transport workers, the private sectors, all the relevant associations. Let them talk to them so that they can use this medium to talk to their own people on the need to comply with the non-pharmaceutical measures. And after giving them like a ample time, a period for them to make adjustments, and if there is nothing a kind of encouraging, I think I will advise that the government, go into lockdown. And because going to lockdown now in this second wave is not an exclusion to Nigerian government, because it is currently a global trend. As you can see what is happening in UK, and you can see what is happening in America. So people are not really complying, and that is our major problem. But you wouldn't blame people anyway, because changing behavior is not an easy thing anyway. But I think we need to still continue to continue our risk communication, continue to sensitize our people to see that whether we can make a meaningful change as regards to this response.